Hello students, today we shall learn about the topic deep vein thrombosis and thrombophlebitis. With what we have learned in our previous sessions regarding varicose veins, venous insufficiency, the next topic will be deep vein thrombosis and thrombophlebitis. So the picture here again, I'm sure it is giving you some idea when you look into the first picture which says deep vein thrombosis. In short, it is called as DVT. Again, to do with the circulation in the veins, the valves insufficiency, not functioning. But what is happening here? Because of that from the spider veins, it is ended up with the venous insufficiency and pooling or stasis, means the blood is getting pooled up and getting collected. With that, there is formation of clots. Now with the deep vein thrombosis, what is going to happen? This clots can actually break and it can start moving in the circulation, and as we mentioned, it can go into any blood vessel, and eventually what it's going to cause is going to be the problems with circulation. And thrombophlebitis means again it is going to be causing the insufficiency or the lack of circulation, and the circulation not going to be effective. And thrombophlebitis means it's going to be affecting the superficial veins, the veins which is on the superficial layer. Now going into the topic, so thrombophlebitis, the way it is being pronounced, is an inflammatory process that causes a blood clot to form and block one or more of the veins. So this is what I explained to you in the beginning. And if this condition goes deeper within the muscle, then that is called as deep vein thrombosis. Okay? And for this again, we follow something called as a virtuous triad. Triad again is nothing but the three sides or the three main important components which you have to look into this particular condition, basically like the signs and symptoms. So basically what happens, yes, there is a vessel wall injury, means nothing but the veins or the walls, the epithelial cells are being damaged, injured due to various conditions and ecological factors, and that is how the varicose veins begin. Eventually that the condition progresses, it becomes in causing stasis or pooling, and that is called as the venous stasis. And there's also going to be hypercoagulability, which is nothing but there's going to be pooling, there's going to be clotting, and this is going to end up in clots, and there's coagulation happening. Now, a definition of thrombophlebitis means clot, and it is related to the inflammation in the vein. And the picture here is clearly showing you how the valves are not functioning effectively, and the blood is not flowing effectively, and this red thing is nothing but the clot. So what happens? Why is that clot formation? Because the blood is not flowing effectively, the circulation is not happening properly, and that blood is going to be sitting there, and it's going to be getting pooled or getting clogged up in one particular place. And as we all know, any body mechanism, the blood sits there for a long time, and after a few seconds, yes, it's going to be causing clots, and we do not want this condition to occur. When this occurs, it is a very complicated situation. Okay, and the formation of this venous clot, why does it happen? So that is what I explained to you in the first slide here. It is due to any of these three important components, and that is what we put into the virtuous triad. Virtue, the name of the person who's shown us this, and triad is this nothing but he's shown us into this diagrammatic or the picturesque representation of showing these three important components, which is nothing but the venous stasis, means how the blood is getting pooled in one particular portion of the vein, injury to the vessel wall, and also the hypercoagulable state, means nothing but again resulting in this particular clot condition. So what is the reason for this, or the ecological factors? Yes, it could be due to any sort of injury to the vein, it could be inherited, long periods of immobility, like you're sitting for a long time, and especially in patients who've had surgery and who's been in bed for a long time. Again, this can also result in that, and that is the reason why we have noticed that patients having surgery usually are being provided with these stockings. Okay? And the stockings are being provided so that again there's going to be a circulation happening properly and effectively, especially when the person is not being is expected to move around and with this particular stocking, and not just lying in bed with the stockings worn. Again, and when the women is pregnant, and when especially seen in anybody using this birth control pills or any kind of hormone replacement therapy, if they're on, having a family history of blood clotting disorder, any other previous episodes of severe varicose veins or venous insufficiency, or even episodes of thrombophlebitis, like any superficial veins are being affected with this particular condition, and where there is clot formation in the superficial veins. If the patient has had a stroke in the past, age is also another important factor. When the patients are older than 60, heavy weight or obesity, cancer can also be a cause, smoking, alcohol, and also stress is also one of the important causative factor. Now, the pathophysiology in this is what? Yes, due to all these risk factors, yes, there could be venous stasis, injury to the vessel wall, and also there can be clotting, clot formation in the vessels. And due to this, again, thrombus formation, the thrombus formation occurs, and this can be either in the superficial veins or it can be affecting the deeper veins as well. So once this has occurred, then there's a high risk of pulmonary embolism. Means what happens when this clot breaks? Okay, it can travel to any portion of the body, it can affect any organs, and the circulation can be affected or blocked completely. So PE, or nothing but pulmonary embolism, that is nothing but affecting your lungs. So when you know the lungs are affected, means yes, there could be a complete respiratory arrest, and yes, death is now the ultimate complication. The clinical manifestations of this particular condition, yes, superficial thrombophlebitis, there could be, yes, the patient is definitely going to be complaining of pain, swelling, redness in the area, warmth, tenderness, and when it is deep vein thrombosis, yes, definitely pain as well as swelling. The complications will include pulmonary embolism, chronic venous insufficiency, and also this can be managed by doing appropriate diagnosis, so that will be having a chest x-ray, ultrasound, and also doing a complete blood profile. So you need to know your bleeding time, your clotting factors thoroughly, and if the patient is on any other medications to keep the blood thin, or to not to have that injury or not to have that blood flowing. So all this history collection has to be done. What are the medications the patient is on? What are the kind of health issues the patient has had in the past? Any kind of surgery? Any kind of illnesses, and even if the illnesses are present, what are the medications on? So all this has to be charted thoroughly and effectively, because we need to know if this is what is causing this particular condition of thrombophlebitis. And to rule it out effectively, yes, performing a venogram, a lung scan. As I told you, the complication could be PE, which is pulmonary embolism. So it's very important when you know that it is something related to thrombophlebitis. Yes, finally the deep vein can also be affected. So we need to rule out, do a lung scan, because we do not want any of these clots traveling to the lungs. And also more effective if they could perform a pulmonary angiography as well. So nothing but again checking out the circulation that is leading to the lungs, and just to rule out if there's any kind of blockage or clot formation. Diagnosis, yes, as I mentioned to you, ultrasound, blood test, deep vein thrombosis, we need to check the D-dimer blood test. That is nothing but a D-dimer is nothing but a protein, okay, that is being produced by the when there is excessive blood clots. And we need to rule this out because, again, to rule out pulmonary embolism. So a D-dimer test, we need to know that the levels are appropriately maintained, and it has to be done, when suggested, because very, very important to rule out this kind of particular complication. Ultrasound, venography, as well as an MRI. Management for this will be medical management, will include blood thinning medications, clot dissolving medications, as I told you, in order to make sure your blood is thin, there's not going to be any sort of clot formation. Compression stockings, and also vena cava filters, again, as a surgical procedure, so we do not want any sort of clot traveling through. And also, as I mentioned to you previously, the varicose vein stripping or lighter or surgery. And for the deep vein thrombosis management, so again, commonly what we say is elevate your legs, make sure you're mobile, compression stockings, make sure you have your anticoagulants, like the medications which keeps your clot away properly. Even if the patient is on IV heparin, intravenous heparin, again, ensure that the dosage is right, and watching for excessive any sort of bleeding, because again, it's heparin is going to keep your blood thin, so we need to ensure that it is only given in appropriate doses and amounts, because we do not want the blood to go excessively thin, and it does not have to be flowing. Aspirin, anti-platelets, as well as the thrombolytic agent is very, very important. Again, making sure that the doses are clean. So compression stockings is what you see in this picture here, the second picture, and how you wear it. It's going to be keeping your legs compressed. And also there is also pumps, as you see in this picture below, when the patient is on bed, and there are pumps actually to pump it up the sleeves, like that's nothing but like the stockings. So keeping it pumped, again, it's going to be putting pressure on the veins, and that is going to help the circulation happening. And all this you will see, especially in obese patients, and especially when patients have had a surgery, they would be using this, because we do not want the patient recovering from a surgery but ending up with a deep vein thrombosis. The treatment will include, yes, preventing the clot from getting, yes, definitely there's going to be clot, so we do not want the clot to get bigger, and making sure that prevent the clot from breaking. and reducing the chances of deep vein thrombosis, making sure that the blood thinners are administered to the patient, and if the patient is on a warfarin is okay, you need to do regular blood tests and just to make sure that the levels are maintained and appropriate, and also ensure that the pregnant women should not be taking any sort of blood thinning medications because it's going to be affecting, we do not want any sort of bleeding happening there, and making sure that they follow up with their appointments thoroughly, because every time when they know that they are on blood thinners, yes, blood investigations are very important, the report to be produced and also to be checked by the doctor and the dosage adjusted appropriately. Clot busters, as I mentioned to you, yes, we do not want any sort of complications like pulmonary embolism, and filters is nothing but like a vena cava filter you put into the venous system, and again that actually the clot that breaks, okay, especially as I told you, when there is a clot formation, it can for some reason break and start traveling, so it just gets trapped. It's like a filter, so we are trying to avoid that clot from reaching your lungs. And compression stockings, again to reduce the chances that the blood will not pool or clot, so that is the reason. So it puts pressure on the venous system so that the blood will be flowing effectively, and also making sure that you wear them on your and till about your knees. Okay, sometimes you also have it extending to your thighs as well. So follow the instructions. And the nursing diagnosis, again, most importantly here would be your acute pain, infective tissue perfusion, ineffective impaired skin integrity, risks for complications, an imbalanced nutritional status, and also it can be it can also be deficient knowledge. And nursing interventions will include prevention, education, leg exercises, compression devices, elevating the legs, administering anticoagulants, maintaining that, wearing the stockings, preventing any sort of trauma, injury, infections, monitoring for complications, which is the most important one would be here is pulmonary embolism, because as I told you, and ensuring that the lung scans are being performed, because we do not want any sort of respiratory arrest. The nursing care, again, providing the patient appropriate comfort, bed rest, making sure he's given extra pillows, legs are elevated, changing positions frequently, teaching the patient not to be rubbing the area or scratching, daily measurements, making sure the scans are appropriate, making sure the blood investigations, if ordered, are being performed, making sure the patient is wearing the stockings appropriately, making sure the patient is mobile, and in case of pain, and if it's okay for the patient to apply the heat application, just to make sure that he's relieved from pain. Okay, but again that depends upon the condition of the skin, so that's also very important. Assessing for complications is very, very important. Embolism, like clot formation, and also making sure there is not going to be any sort of respiratory problems, keeping the vitals checked, monitored, and also making sure that providing psychological support both to the patient and the family is very, very important, and also educating them all the way through, even while this is being done to the patient, that what is happening at every point of time also makes them feel. Prevention and education will include teaching the patient importance of being mobile, not to be sitting in one position, moving the legs regularly, making sure they have a good diet, fibrous diet, reducing the salt, and making sure the other comorbidities like hypertension, diabetes are under check, watching for your body weight, obesity to kept under check, moving around, wearing your stockings, and also making sure the medications are being taken appropriately, and as I mentioned, depending upon the skin condition, if he feels better with the moist heat application, if that's going to give him comfort, and also making sure that they regular follow-up appointments. So with this, we have finished the venous disorders, most of them, and I shall see you in my next session. Thank you for your time.